Hello guys, welcome back. In today's video, I'll be talking about the various tests any woman or any man trying to conceive should ensure that they have gone for. If you have not gone for this test and you are trying to conceive, you are missing out. Maybe one of those tests will be able to detect what is actually wrong with you. Don't go about taking medicines, taking natural remedies without proper diagnosis. Proper diagnosis is the baseline for an effective treatment. All right, the first test I would like to discuss about is the ultrasound. Every woman trying to conceive should ensure that they go for is the ultrasound scan. Ultrasound scan has the ability to check the abnormalities in the pelvic, that is the female reproductive organs. In ultrasound scan, they will check the ovaries, the uterus, and even the cervix to ensure they are okay, that there is no mass or any growth in each of them. This ultrasound scan will be able to detect whether you have PCOS, ovarian cyst, fibroid, and sometimes endometriosis in the sense of endometriomas. They are able to detect those features in them. The next test every woman should ensure that they do while they are trying to conceive is the ovulation test. In this test, you can use strips or even the tracking method done by the hospital to check whether you are actually ovulating. Use of the strips will help you to know whether there is the ovulation hormone, which is the LH, whether it is detectable in your blood during the ovulation days. The ovulation tracking, which is done in the hospital, will ensure whether you are able to release an egg during your ovulation. This test mentioned provides a baseline for other tests. When you go for ultrasound first and do this ovulation testing and everything is okay, then you can proceed to other tests such as SSG test. In this test, it is used to check the patency of the fallopian tubes to ensure whether the fallopian tubes are open or not for conception. Sometimes when this SSG is done, the contrast media that is being pushed into the vagina, then that enters into the uterus to check the patency of the, the fallopian tubes, tends to unblock a little mass in those fallopian tubes. That's why you hear women, they will say that after I have gone for SSG test, I am able to conceive. I conceived a month after my HSG test. I conceived 2 months after my HSG test. That means there is a little mass on their fallopian tubes in which the contrast media, the force from the contrast media is being able to flush those mucus or anything, little thing blocking the fallopian tubes away. So this test is very important while trying to conceive. Then semen analysis. This test is important for men trying to conceive. Any man trying to conceive and you have not gone for semen analysis, you are joking, because it could be the cause of the problem. Gone are the days when they say that lack of conception is for the women only, that men are always okay. Now, 50% of people trying to conceive, 50% of them, the problem comes from the man, because there are some things, factors in which men are exposed to tends to destroy the male reproductive organ. So any man trying to conceive that have not gone for semen analysis is actually joking, because it's in that semen analysis that will detect whether you have azoospermia, low morbidity, that is whether the sperm is complete, the count is complete, whether the sperm is able to swim, the strength of the sperm is able to swim close to the egg, whether there is anything wrong with the sperm. It is in semen. Another test you should ensure you go for is the blood test. This test is able to detect the hormones responsible for conceiving, whether they are actually in the normal range or high or low. For example, the progesterone. When the progesterone hormone is low, it can be a problem. When estrogen hormone is high, it can be a problem. That's why you detect high estrogen in women with PCOS, ovarian cyst, and others, like and fibroids too. So estrogen is the hormone responsible for that abnormality. So when trying to conceive, you should ensure you go for blood test or hormonal assay to ensure proper hormonal profile to know whether your hormones are in normal range. If you conceive eventually and your progesterone hormone is low, you cannot be able to carry that pregnancy. That's why most women suffer miscarriage. Most women that suffer miscarriage, low progesterone is at most times the cause of their problem. So you should ensure you go for proper hormonal assay to identify any hormone that might be causing the problem, that might be causing you not to ovulate, or or that might be the responsible factor for the fissures. Another test you should ensure you go for while trying to conceive is the genetic test. This test helps to as in rule out any abnormality found in gene of any of those partners. For example, you know, PCOS is usually in the gene. Most families suffer PCOS more than others. You will come to a family and you see three sisters suffering from PCOS. So those things is what you check while trying to conceive. Whether you have had that issue previously in your family, whether any member of your family have suffered it. So another one is endometriosis. Those things are found in gene. Then Turner syndrome, problem with the chromosome. Some people they give birth to children with chromosomal abnormalities. Than another factor in genetic that can contribute to infertility is premature ovarian dysfunction. In some families, their women tend to go into menopause earlier than others, while some people have this condition known as premature ovarian dysfunction, in which the ovary stops releasing egg at very young age. So these factors contribute to infertility in genetics. So that's why genetic testing is very important. Genetic counseling is very important while you try to conceive. Today, I will also share the health tips that can help you while trying to conceive. The first one, try to exercise. Most times, women with PCOS, resistance, exercise might be of great advantage to you. Another one, you should ensure you meet with your healthcare provider, that is the gynecologist, to rule out your problem and go for proper treatment and checkups. Another one you should do is ensure you rest. Stress contributes a lot to hormonal imbalance, which may be the reason why you are not conceiving. If your work is stressful, try some relaxation techniques while trying to conceive. Another one is healthy diet. Ensure you eat a lot of healthy diet rich in fruits and vegetables to ensure balanced hormone. Avoid excessive fatty food caffeine, and other food which that are very rich in dairy products, because dairy products are foods that are high in estrogen. So once your estrogen is high, it can contribute to ovarian cysts, fibroids, and other abnormalities that affect women today. So, all right, thank you for following in today's video. If you like this video, don't forget to like, share, comment, and follow me for more health tips. Thank you.